Hi, my name is Andrea Bucalato, and I am the Program Manager of the Complementary Care Program at the Dartmouth Cancer Center. I'm so pleased to welcome you to this webinar this evening. Our topic today is the Dartmouth Cancer Center Survivorship Program. Before we begin, I will cover a few housekeeping items. We are recording this presentation, and it will be available on our Cancer Center website at a later date. As questions arise during the presentation, please use the Q&A feature on your Zoom screen. We will reserve time after the presentation to answer your questions. Our speaker today is Elizabeth McGrath. Elizabeth is an advanced practice nurse currently working as a nurse practitioner in the gastrointestinal program at the Dartmouth Cancer Center. With over 40 years oncology experience, Elizabeth has worked in a variety of practice settings, including both radiation oncology and hematology oncology. Elizabeth has extensive clinical and teaching expertise and holds certification as an adult geriatric acute care nurse practitioner, as an advanced oncology nurse practitioner, and as an advanced certified hospice and palliative care nurse. Elizabeth is also the director of the Dartmouth Cancer Survivorship Program and is here to speak on that topic this evening. Elizabeth?
Thank you very much, Andrea. I'd like to give a shout out to my colleagues here on the call, Andrea and Amy, who are part of the Survivorship Program Committee, and welcome their participation and the invite to give this talk tonight. What I'm going to share with you tonight is really what recent research we've done looking at the survivorship needs of our patients. And I will share with you some of the results we obtained as we go through. But first, give you a little background. You know, we know if you look on the graph that over 26 million survivors will be alive in 2040. And this is due to, number one, if you see the dotted line there, many more people, those are the baby boomers, and we're aging. So we are going to be part of that survivorship group. And really advances in the cancer screening and early detection and an improvement in our therapeutics most recently, and combined with supportive care, they are really all contributing to this decreasing cancer mortality. And the interesting thing about these 26 million survivors, they will be in their 60s, 70s, and 80s. And that'll be important as we move through the statistics. So how do we define survivorship? Most people these days are defining survivorship as starting at diagnosis and lasting through someone's lifetime or lifespan. And this is a definition that's agreed upon by the National Cancer Institute, Office of Cancer Survivorship, the CDC, Disease Control and Prevention, the National Coalition for Cancer Survivorship, and the NCCN, which is a National Comprehensive Cancer Network. In survivorship care, we also know that there are guidelines that have been agreed upon among many different societies, such as the American Society of Clinical Oncology, the National Comprehensive Cancer Network, which is a warehouse basically for us to have access to up-to-date guidelines on the best care for our patients. And these guidelines are updated every year. And then the Children's Oncology Group is very interested in, obviously, childhood cancers. When we talk about survivorship and our guidelines, what are we really talking about? What do we need to provide our patients? Well, clearly it's healthcare delivery, right? But wherever you are in your disease trajectory, whether it be before treatment, during treatment, or after treatment, or ongoing treatment, you need to have your care needs met in very much in a holistic way. We need to think about the physical effects of treatments and cancers, psychosocial effects. If you have other chronic conditions, how is that interfacing with how we're treating you? We have a very large focus in survivorship on health promotion. And if you are done treatment, we are really having to monitor you for recurrence of your treatment and any new primary cancers. Most recently, we've added special population and care coordination to our health care delivery model. So we really want to look at what are the special populations, excuse me, I apologize. Special populations such as the older population that I just referred to, and obviously the younger population. And then care coordination with your other care providers is very important because you have ongoing healthcare needs other than oncologic. So it behooves us to coordinate your care and coordinate your cancer care throughout your disease trajectory. So in 2006, the Institute of Medicine and the National Research Council published the publication of From Cancer Patient to Cancer Survivor. And what they found is patients were feeling very lost in transition from active treatment to no treatment. And this is where the notion of cancer survivorship care plans came in. And that was designed to provide patients and their primary care physicians with information on how best to care for you. What were some of the long-term and late effects that we might be concerned about? What were we going to do for surveillance of their cancer process? Who was responsible for scans? And then what were some of the things that the cancer patient could do for themselves, to care for themselves and to promote that health promotion, whether it be smoking cessation, exercise and diet, use of sunscreen, if it's a bone marrow transplant patient, when will they get their vaccines, that sort of thing. So it was a very all-encompassing document that helped to provide the patient with their past treatment, but also what can they expect going forward. And we had spent the last decade, literally even more time, trying to come up with these survivor care plans. It is now changed. We are currently COC, which is Commission on Cancer, accredited, and the COC has changed their standards in 2020 to really transition from the required survivor care plans to a survivorship program. And so they really eliminated this mandatory survivor care planning, which was taking up an enormous time as research showed, with little benefit. I will, however, posit that the work I did and the research I did with doing survivor care plans, they were very much enjoyed by providers and by patients, but it really didn't change care outcomes. So this is where, when I say the research didn't pan out, that's what I'm referring to. So now the COC is asking us to provide programs and to offer a minimum of 3 services that address the needs of caregivers. And that is along the lines of this healthcare delivery. You know, what are we doing to meet psychosocial needs, if you will, or health promoting activities, that sort of thing. And we are to report out those on an annual basis. So when this came out, and we decided as a committee that we really are needing to think about what are we doing and how are we doing it, and what do we need to do to change. So we set up a survivor QI process this past year, which is headed up, the project manager is Jennifer Williard, who is responsible for strategic planning for the Cancer Center. And I was the project lead, being the program director. And what we decided to look at was, how do we ensure that we are in compliance, number one, with the standard, and how are we improving on the existing survivorship services at the Dartmouth Cancer Center? So what we decided to do is really look at what the services are, look at our patients being referred, understand the barriers to access, and we used focus groups, and we also used surveys, which patients and providers and allied health were all asked to participate in filling those out. They were all emailed out, and then we looked at the results. But what we set out to do was, we really want to think about standardizing documentation in the EMR, the electronic medical record, so that when we are addressing survivorship issues, it's easy for the patient to see, but also the primary care and other care providers. We want to better align our survivorship program with what the patient's needs are, whether they're the individual patient or the population of cancer patients. and then educate providers across the DCC about the survivor program, but also throughout the DH system. What is the referral process and how to document that survivorship? So this is what we're talking about tonight, is the survey results that we obtained. So when we look at our survey, the total number of patients and care partners that filled out the survey for us were 79. There were 74% or 59 people who were patients, and then 25% identified themselves as care partners. And what we asked are several questions, and it began with, how would you define a cancer survivor? And when you get this type of data, it's qualitative data because people are writing down what they're feeling. You want to think about how people are answering the questions and try to group the answers in separate buckets, if you will. And so what we came up with was 4 buckets for these answers. And one was the patients diagnosed. They defined survivorship as diagnosis to the end of life. The other group said it was when you completed definitive therapy through the end of life. And then there were some personal characteristics, which I will go over. The group that was diagnosis to the end of life, they were 38 statements. And these are just summaries of many of the topics they talked about. This was encouraging because I truly believe that people who are living with metastatic disease and having ongoing treatment are still surviving their cancer. And I believe that they are absolutely part of this definition. Someone that is alive, that could be anyone from that disease diagnosis to the end of life. Anyone who's living with a current or past diagnosis and they still may be in treatment or beyond it. A person beating the disease, that can be anybody. Someone said, I have cancer and I'm alive. Maybe that makes me a survivor. I've survived anyway, so far anyway, so that I'm putting myself in that bucket. Someone said, I made it through bone marrow transplant. I know I'm not yet in remission, but I survived the transplant so far. And so that's enough for me. I'm not waiting 2 years to call myself a survivor. A person who is beating the disease, and then someone else said either a patient who has been told that their cancer is gone or someone who's able to continue on with a reasonably good quality of life through ongoing treatment. And we hear a lot through this data about quality of life. And then someone simply said, as soon as they're diagnosed. I'd like to talk a little bit about not waiting 2 years to call myself a survivor. As clinicians, we oftentimes will be, by survivorship guidelines, will follow a patient for a number of years, and at the end of that time period, we will say you are considered cured, or you are released from being followed by the cancer center, and that can vary depending on the disease. So some people say 2 years, some people say 5 years. In breast cancer, it can be longer than that. So it really is dependent on the disease. So it can be really misleading. There were 33 statements on completed definitive therapy through the end of life. So those people said, I'm cancer-free. The word remission came up a lot in this group of people. Remission, or the cancer is gone. Someone who's completed their treatment. Somebody who does not presently carry the diagnosis but had that diagnosis. People who have been diagnosed with cancer, treated with surgery, chemo, or radiation, but they have no recurrence in the last 10 years. They've achieved a disease-free state, or we call that in our clinic terms, NED, no evidence of disease, and that's following diagnosis and treatment. And then someone who is treated for cancer and resumes a daily life. It was one of the responses. Some of the personal characteristics. So these were people who just gave us words to describe a survivor. So many people said someone who is hopeful, someone who needs to be strong, empathetic, brave, a fighter, a thriver, not a survivor. That was said more than once. Some define themselves as feeling very fragile, vulnerable, cautiously optimistic. And we see that in our practice quite a bit. When you leave active treatments, sometimes that is a very vulnerable time because you're not having that close follow-up. or you're fragile and vulnerable because you're still undergoing treatment and you're not sure of what the absolute outcome will be. People feel relief and happiness. A person who finds a path to healing and wholeness when challenged by their cancer. Someone else said enjoying life and feeling good on a regular basis. Or someone who's reclaimed an acceptable, again, to them, quality of life following cancer treatment. So again, here's that quality of life, which is very important. Someone who's determined, strong, is identified as a survivor. One who values life in a deeper sense, so people find meaning in their disease trajectory. And they have a self-defined, meaningful existence, whatever that may be for them. And one other person said someone has to be tough and resilient to be a survivor. Going on, we asked, how would you describe a survivorship program? And this had a lot of statements regarding comprehensive in scope. There were 35 statements. So what these people had to talk about was that they have all the information and supports that surround the medical care they receive. There's a support system for those impacted by cancer, both the patients and the loved ones. The exercise classes are critical to people in their well-being and various programs to learn new techniques for living with stress and cancer. A program that helps meet the needs of cancer survivors and caregivers. They described offering both general supports and services. Connection comes up. That's another term that came up quite a bit. Making connections, both in person and online, as well as specific supports for types of cancers. So what was important for many people who answered this was, I am an AML patient, an acute myelogenous leukemic patient. I think that that is a specific enough diagnosis that I'd like a support group just for my diagnosis. Or others who said, I just would want to meet somebody who is the same diagnosis as me. A program that offers general supports and services, again, with connections. Oh, sorry, I'm repeating myself. Another person said, when I can get the level of support I need or want and all the information I need about my disease, its treatment options, and post-treatment care and monitoring that will be needed for years in the future. A program that helps people in their striving to survive, providing emotional support is a big factor, as well as lifestyle and health support, and providing tools for rebuilding one's life. A survivorship program was described as encouraging people to be real, authentic, to allow themselves to heal. Healing was another very common word used. They also want to be able to ask for and accept help in different ways, to stretch in the way that they think, and to believe in themselves and their support teams. Another person said it's a program that provides preventative care, emotional support for the effects of treatment, and education about the risks of future and secondary cancers. So a lot of these people are very knowledgeable about what we're trying to accomplish, going over that slide at the beginning. It's a program that provides information and resources, activities and classes, services, and support for cancer survivors and their caregivers to help in their diagnosis, treatment, and continued survival. And again, a whole range of therapy designs to support recovery was another person felt was important. Many positive descriptors are used. Again, the word hopeful comes up, a very beneficial, useful service. Thank you for the opportunity. Useful, encouraging, supportive, hopeful. My experiences have been extraordinarily positive. It is helpful, and they appreciated understanding and support of the programs that we offer. Another category in this description of a survivorship program were general supports, and there were 15 statements, and they kind of gelled down to a program that supports the cancer survivor, to support anyone living with cancer, their friends and their family, a support system for them. And one person felt education was key in this process. It's a program that provides support for the non-medical aspects of surviving cancer. And it's very important to associate with other people facing similar situations. And this person went on to say to try new things, to write, talk, do art, yoga, meditate, cook and eat, sing in new ways. Another person, a program that supports cancer survivors by helping them reflect on their experience and helping them maximize their post-cancer life to the fullest. And then supporting healthy living, getting into that health promotion notion. Another category was it's a way to connect in the survivorship program. So it talked a lot about support groups. And then they can talk about their thoughts and feelings about receiving the diagnosis, treatment, and gather together to share their experience and support each other. A program that supports that to happen by introducing approaches, resources, and connections to others. So a variety of things. One important fact about the program is that it puts one in touch with people who share similar thoughts and experiences, and with the professionals who are trained to help us manage our physical and emotional reactions to cancer. So very important that they have that social support. I'm thankful for time spent with courageous men and women in support groups. The survivorship program helps enrich cancer survivors' quality of life and also helps the survivor to feel part of a group and not so isolated. Ideally, it's a community-centered around survivorship, offering cooking classes, meditation, art, social opportunities like group hikes, walks, etc. And then someone described a community as a community, the survivorship program as a community. And then transitioning back to normal, healthy living, help could take a form of support groups, specific classes, exercise programs, counseling, therapy. And then patients living with cancer, such as group programs, could also be helpful, as living with cancer is scary, unfamiliar, and a journey into the unknown. Another theme that came out of our research was that survivorship programs address needs at all stages. So a program that provides information and resources, activities, classes, services, and support for cancer survivors and their caregivers to help in that diagnosis, treatment, and survival aspects. It would be designed to meet the needs of patients and caregiver wherever they are in that sometimes long and scary journey towards healing or towards the end of life. So that person is really thinking of this as very holistic and inclusive of everyone. A compilation of ongoing programs that address healthy living, including nutrition, physical and creative exercise, meditation, prayer, spirituality. It begins at the diagnosis and continues on for as long as the patient desires the program. So they don't give really an end, it's really what the patient desires. Survivorship should be iterative, it should be ongoing in terms of that. And the patients, caregivers, and the DHMC team, doctors and nursing staff should be able to celebrate every stage of a patient during their survivorship. One that supports a person on diagnosis throughout treatment and then continues through their life. Honoring the full spectrum of recovery from diagnosis to death. And again, they mention specific art, music, writing, therapy, movement, family support, information, and education. People felt that coordinated care was another important aspect, that if you're no longer diagnosed with cancer, but you have a program that provides preventative care, emotional support for the effects of treatment, and education about the risks of future secondary cancers. I have a question in the box. So those who still suffer from the unexpected fear of dying too early in their life due to cancer, can anti-anxiety medicine be continued for as long as it's beneficial? I think that that's a very good question. I think it's up to you and your provider. I think that anti-anxiety medicine is part of dealing with anxiety, but there's also psychosocial types of programs we have, such as psychology with cognitive behavioral therapy. We know that some of the anti-anxiety medicines can be highly addictive, and we want to try to address the core notion of that anxiety, and we can do that sometimes with some psychological services. But I think it's really up to the patient and the provider, and we talk about this as we go through our treatment with the patient. So there's, this person says coordinated care is seminars, diet and exercise after cancer. There should be a way to follow patients and make sure heart health after chemo and left-sided radiation is used. So this is somebody who probably had lung cancer or breast cancer, and they want to make sure that they don't have long-term side effects from radiation, and that the cardiologists or other specialists, I think, should be available to work with patients at risk after treatment, which is a very good point. Appointments with your oncology primary doctor every 6 months to assess your continued health and answer any cancer questions. And this coordinated care was addressing also checkups and follow-up tests, which that survivor care plan does very well. All right. So then we went on to ask, how did you hear about the family and patient support services? And these answers we'll go through. So, oops, sorry, I'm trying my screen. So we found out from the patient and family support services. We have pads that we can give to the patients that say, these are services available to you. So that was about a little over 40% of the patient, 42%, 40% said they found from a member of the care team, the doctor, nurse, secretary, or whomever. People got about 21% got information from the Dartmouth Hitchcock website. We do have a Facebook page that people can avail themselves to, and they found out information from them, but that was a very small amount. We got to get that message out there. Some never really heard of the patient and family support services, which now is complementary care. And then there were other responses. And then we asked, how knowledgeable do you feel about survivorship services that are available to our patients and care partners? About 21% felt very knowledgeable, and 46% felt somewhat knowledgeable, and about 31% felt not knowledgeable at all. So there's a real knowledge gap there that we have to close. We went on to ask, did or do you ever participate in services outside of those offered at the cancer center? So for example, acupuncture that's offered in the community, or the exercise program in the community here. So people had said, 37% said yes, they had availed themselves, and 62% said they did not. And this will be important as we go on through the data, because what they identified is, I live far away, I may not be able to participate in those types of activities, or in my community, I don't know how to avail myself to those activities. So then we asked, how important are or were the survivorship services to you or your loved one's care? 52%, more than half, said it was very important, and 35 or almost 36% said it was somewhat important, and then about 11% said it wasn't important at all. We asked, what can we do to better describe or promote the importance of survivorship to patients and care partners? And these categories came into direct connection with complementary care services, increased visibility of the services, having services in multiple locations, and better training for staff, providers, and patients. And then they gave us some positive feedback, which we'll review. So direct connection with complementary care, that came up to about 13 statements. And they went on to say, offering a meeting with a patient and family right at the beginning when they're diagnosed, don't wait. Incorporating meetings with the coordinator so the patient becomes aware of the services and supports available. Would like to have a meeting with the program coordinator, Michelle, in the second weekend of treatment to go over what's all that's available. They recommended, many people recommended emails, and the calendar of events are very helpful. Have the providers make suggestions to the patients. I think you would benefit from the yoga program. What do you think? And that goes a long way for patients to participate in some of these activities. And then assigning a staff member to provide information when someone becomes a patient. So in another slide, one of the patients said, well, you know, when you take my vital signs and you get me ready for the doctor's visit, why don't you just hand me a brochure about these services when I'm in the waiting for the provider? So making personal contact was very much identified. and checking in and seeing that, to provide that overview of what they have available. So again, it's just getting the word out. So direct connection. We also identified statements that spoke to increased visibility. So I'm a cancer survivor. My husband just passed away from cancer, and I still don't know what you totally offer. And this was somebody who was a nurse. So here at the institution, and she still didn't know what we have totally to offer. People said, emails about upcoming offerings or publicity, stronger, more specific marketing on how and why these services might help, having a synopsis of what's available and the possible benefits. It's one thing to know what's available, but people really want to know, how will it benefit me personally? And then there should be a letter, what this person felt, explaining what survivorship is exactly. I think that's one of the things that we've learned through this research is how do we all identify as survivors, and does everyone follow the same definition? Someone suggested newsletters outlining programs and benefits, short or online videos to make it easier for some to take the leap and engage in the programs offered. Advertise in the community using the radio, paper. Patient portal was suggested as a useful place for someone to check in and provide an overview of support services that are available. So really concrete suggestions. Another thing that came out of this question was services in multiple locations. So connecting with providers around New Hampshire, Vermont, who provide similar services so that survivors can utilize their services and can promote survivorship health. And we know that across the state and into Vermont, our patients travel a long distance. So what is available for them in their own communities? People felt that the programs were offered a lot during working hours, and if they work full time, they're not sure how to access that. But they'd like to, have better communication and more ways to access programs. Please set up programs outside DH campus. People travel 100 miles for cancer treatments. This was a patient who received all their care here, but then had follow-up at Brattleboro Memorial Hospital. And she went on to say, I'm always surprised that your Zoom survivorship services are not promoted through Brattleboro. People felt that they'd have more interest if they were closer, but again, that distance is very difficult. Offer information sessions online and in person, using webinars and health and wellness fairs are some ideas that they came up with. So again, just multiple locations, but also multiple ways to provide our services. Another theme that came out of this question was better training for staff, providers, and/or patients. There were 16 statements that really sugared down to talking about them is really what would help them so that they know. Again, this is the person who said getting ready to see the doctor. After you take the vitals and going over med list, why don't you give me some information about that? Proactively contacting survivors about the services, having the providers make these suggestions. Check-ins would be helpful to instill a feeling of support and assist in possible mental health status. Medical providers recommending these services, and again, having the doctors encourage the patient to engage would go a long way. Positive statements for survivorship program was, please keep doing what you are. It's extremely important to all. You're doing it well now. Certain amount of self-starting by the individual is important. I get regular notices from you, so it seems sufficient. I think you do a good job now. I think you're doing fine. Keep at it. I like that. Keep running and always striving to be better. I like that. Generally, people think we're doing well, but I think there is certainly room for improvement for things we'll talk about at the end. In your opinion, how can the Cancer Center better acknowledge and support care partners? So this is specifically to partners. So there were themes out of this question. There's proactive communication, giving them positive feedback, giving us positive feedback, and expanding our services. So for proactive communication, there were 18 statements, and they basically said, we want you to reach out. We want you to explain what the services are, but nobody ever explained them recently because of COVID. We didn't have a lot of our services available in person. We did do a lot online, and Andrea can talk about that. Checking in with me, keeping open in communication for increasing engagement. Reach out to the care partners to offer support and ask how they'd like to be supported. Reach out continually through the cancer journey. Be approached in person or a phone call so they don't feel so alone. Tell us what you got. Stay in touch by phone, email, or text. So again, it's that communication, but proactive communication. Positive feedback, again, you're doing great. I appreciate that you include us as a care partner. Appreciate that the Cancer Center is looking for ways to improve and expand this. Thank you for wanting to help and care, not for just the patient, but the whole family unit. And the Cancer Center has proven welcoming and accepting for me as a caregiver. And somebody just said, tremendous job. Expanded services for care partners was talked about. Maybe offer a couple of sessions a week to accommodate differing availability, support groups for caregivers. Services are too far away, fix that, and promote services in more areas served by the center. What suggestions do you have for improving the survivorship program? So this could include new program or services to offer. So out of this came better communication, new service recommendations, a bucket of services in multiple locations or formats, improvements to existing programs, and positive feedback. So better communication, there were 7 statements. They really wanted immediate connection. They wanted a supportive website, specific support groups. We talked about that a little bit before. Fact sheets and reference materials that could be available. That care partner support group as a way to communicate. Reading list with useful websites, and promote our services through communication. The new service recommendations, there were 15 statements regarding this. Someone recommended a mentor program for new patients. So somebody who has completed treatment and somebody is new coming into the treatment, would they want to talk to somebody who's been through that? More classes was suggested. Specific support groups, which we mentioned before. Open dialogue. This person said maybe quarterly have an open dialogue with family and friends for open discussion and sharing of ideas. This person had a wonderful idea. Each time someone attends a program, they receive credit or points towards becoming a bronze, silver, or gold survivor. I thought that was pretty ingenious. A lot of people talked about acupuncture, wanting that to be available, and then the availability of therapy or service therapy animals as a part of the program. Services in multiple locations, again, spread out. People had a positive thing to say that Zoom made it possible to attend any of the programs, and I think Andrea will speak to that. Very much that improved participation, and because you could do it from your home, just like we're doing tonight. And then improvements to existing programs, meeting in person. Some people felt Zoom doesn't do it for some of us, including lunch or tea as a way to build community and make it more meaningful. Someone said, why don't we define survivorship in stages? Like, I survived my first chemo infusion. I survived my first month of treatment. I survived, and again, whatever it is that you wanted to do, would that help people feel more included? And again, pleased with what you do, continue the arts, painting, meditation, and appreciate everything you do. So next steps, certainly we hear our cancer survivors and care partners. We have data that this just literally, we have finished collating this data yesterday. And I drove Andrea crazy all day because I didn't have my slides to her. And she was very concerned, but it was literally putting this together very quickly. But our next steps are going to be, we're going to look at this data as a group and go back to the committee we've been looking at the data, just 3 of the committee members, but we will regroup as a committee and look at the data in toto. So looking at what the providers gave us feedback, looking at what the allied health professionals gave us feedback, and then obviously putting this all together with recommendations. And I think, that will be something else we could probably come back and talk to you about. But I think that many of the things that are talked about tonight in these summary slides, we have given a lot of thought to already, such as the website, for example. We are in the midst of developing a website for the survivorship, which will be under the supportive care services, where Andrea's programs are listed as well. But that may be a way that we can provide websites with more information, provide fact sheets, provide hyperlinks for different information for patients and their caregivers. So again, we hear you. We're going to take this very seriously. And I would invite people, there is another question, but I'd invite people to talk about, does this resonate with you? Is it something that makes sense? Do you connect with it? I'd like to hear from everyone. So another question is, are the resources for financial guidelines prior and after death due to cancer if the patient don't have family or friends to help? Yes, there are resources, and we can certainly avail you to those. It depends on what you're needing for financial resources, but there are definitely resources within the community, and all you have to do is reach out. Other thoughts? I don't know, Andrea, if you want to talk about how it went during COVID, providing these many programs.
Well, as many of you know, all of our programs are offered by Zoom with the exception of creative arts and massage. And so the programs are available to all locations. I do think we could do a better job of advertising that, but I also am very interested in looking into other steps that we can take to improve our programs and appreciate all the feedback we received. Does anyone else have questions or comments? Please put these in the chat. We would love to hear from you. Any questions or comments on our program this evening or on how we could improve our services?
Appreciate you all participating, and I hope that you feel if something comes to mind that you could reach out either to myself or Andrea. Yes, someone else has put in a comment that the Zoom is a wonderful tool for those with who are limited in mobility, and I would agree with that wholeheartedly. And someone else said, I've been very grateful for the Zoom. And I think that Andrea can attest to participation was increased with the Zoom. And I think like tonight, what we'd like to do is more of these kinds of webinars and Zoom meetings to help educate patients and their families. Because we have a host of people who can, the 2 people who talked before me the last 2 weeks have been, phenomenal resources, and they're just lovely to hear what they have to say. And I think it's very useful information.
So I see a message from Amy. As we look ahead to provide more webinars of an educational nature, does anyone have suggestions of topics they'd like to learn more about?
That's an excellent point.
Thank you all for your wonderful comments. Does anyone want to suggest a topic for a future webinar? You can always email me at cancersupport@hitchcock.org. Those emails reach both Michelle and I, and we are really eager to communicate with you and receive your questions and comments. Thank you, Amy. Would anyone else like to chat in or comment, question? And Amy's given the American Cancer Society website as well, which has a great deal of great information about survivorship. Thank you for sharing, Peter.
And I can appreciate that. And I think that's where support groups and reaching out to your care providers, to really say, this is what I'm struggling with, because there are a lot of supports around that. And I absolutely hear, the uncertainty is another thing that came up through these questions, people, and I don't care where you are in your trajectory, there's always uncertainty. And sometimes it's heightened in certain areas like this, where this person's going through treatment and they may have limited options. So, that uncertainty is very, very difficult to live with. And I think that's why these support programs can really help you. We have lots of professionals as well as supportive programs that can help you through that.
So there's a question, any plans for heart attack webinars similar to the cancer webinars? That's a very good question, Richard. I could reach out to my colleagues in cardiology to see what they're doing for patient education. And I also know there was some feedback in our survey about follow-up with a cardiologist. So we might find a way to weave that into a future program.
Well, and in fact, one of the things that we could talk about is cardiotoxicity and have one of the cardiologists. There is a cardiologist. He's actually the husband of one of the nurse practitioners who is specializing in heart-related long-term effects of our cancer therapies. So he might be somebody that would be willing to come and talk with us.
Great. Send me his name, Elizabeth.
Yes, I shall. It's Dr. Storms, Daniel Storms.
Oh, okay. Okay. Thank you. Well, I would like to thank you all for joining us this evening, and stay tuned for future information about our educational webinars. We will be sending an evaluation. Please fill it out because it's really helpful to us to help us improve our future educational programs. So we say good night at this time and stay well.
Thank you so much.